Welcome back to Midday Kentucky, everyone. Well, guess what? Do you have a vein disease? What are they? And how can they be treated? Well, of course, Dr. Bacha is here from Lexington Vein Institute to help us understand those issues. Welcome back to the show, my friend.
Hello, Troy.
Nice to see you. Let's talk a little bit about vein disease. What is it?
Well, there's a variety of type of vein disease that I get seen in the clinic. It starts from cosmetic, where the little spider vein that you see on the on the legs, all the way to a big, look like a snake or a cord running underneath the skin. Those are the big varicose vein.
And looks big because it's popping out.
That's correct. Until the final stages of vein disease, where you start have skin changes in the lower extremity and eventually vein leg ulcers.
Are they a painful problem?
Well, initially start as a non-symptomatic issues, and as time goes by, you'll start have some symptom. Pain is the most common, feel like burning, stinging, worse at the end of the day. Of course, you may have edema, you may have leg cramp, you have night cramp, restless leg syndrome, a lot of symptoms associated with vein disease. Okay,
something very interesting. What are the differences between cosmetic and medical treatment that is available? Now, let's bring up the video.
All right.
Because one of these procedures that you do that we've recorded, explain to everyone what you're doing.
So this is a sclerotherapy. This is a purely cosmetic. If you have a spider vein, then you will inject it with a sclerosing agent and make it go away. A lot of time insurance do not cover these procedures because they're just usually not symptomatic. And I'm talking about the little spider on the legs.
Okay, but it's gone instantly.
That's correct. Well, they'll come back in, they'll come back in brown, and it takes about a few weeks for them to resolve. But when we inject them, you can see the result immediately is gone.
So this procedure that I'm looking at now is not covered by insurance?
Most of the time it's usually not covered. If we're just dealing with just simply a spider vein or what we call telangiectasia.
Okay, so let's bring up the images that we have, because these are some of the medically issues that we have when it comes to vein issues, which are covered by insurance?
Correct. So if you have varicose vein, that the thing that sticks out, or sometimes they not necessarily stick out, but they look like you have some blue things underneath the skin. Then those usually causing symptom, and if they're causing symptom, they're covered by insurance. So you can see this is some before and after. This is only a like 3 weeks apart. So it's,
really,
of course.
Wow. Yeah. Now, what are the health concerns by having these? Like, these look pretty severe.
Of course. So the health concern, beside the symptom that you can have, anybody with a varicose vein have a 9-time higher risk of developing blood clots, dangerous blood clots, correct. And then eventually you start have skin changes, and that's the ultimate risk of vein disease. You have those vein ulcers that happen on the legs. They're very, very hard to heal, and require a specific treatment to get him healed.
Can I ask you, now women, this is one of the side effects of being pregnant. A lot of pregnant women get severe varicose veins, don't they?
Correct. So the prevalence of vein disease is very, very high. So women usually have higher prevalence than men, but we still do a lot of men, as you've seen in these photos were men. But pregnancy is one of the risk factors. Of course, a lot of the occupation where you stand on your feet for a prolonged period of time. Hereditary factor definitely play a role. So if you have family history of varicose vein, most likely you will have some. But of course, environmental factor play a role. We see a lot of teachers, a lot of nurses, a lot of doctors.
I was going to imagine a lot of hairdressers too, let me tell you.
Absolutely. I suffer from it. I had mine fixed.
Yes, because you stand up 24/7 as well. I want to ask you, how do you fix the medical ones? Is it stripping? Is it how?
We don't do stripping anymore. It's very simple. It's in and out. It's in the office, done procedure. While you're awake, it takes no longer than my part. Take probably 18 minutes. I'm done. Of course, the whole procedure about 15 minutes from the time that we get
really
clean. Yeah, of course. It's very simple. So all you do is you come in, we do a consultation, we do an ultrasound, we map the vein, find out where the problem is, find out whether it's a medically necessary or it's just a cosmetic. We talk about the options available, and then we'll schedule the procedure. You walk in, walk out. You don't even need a driver. So I always recommend the driver because your legs might be numb. But I mean, it's that simple. I went to work the same day after mine.
But you're tough.
Well, I'm not tough.
See, I'd probably have a week off work, everyone. So what are some of the ways of, just very quickly, how we can prevent them?
Well, there is really no proven prevention method,
really?
Of course. But I recommend for everybody to wear a compression stocking if they have the occupation where they have to be standing on their feet for a prolonged period of time. But there's no medical evidence that they will even prevent or slow down the progression of venous
Okay,
disease.
well, you also have a promotion for our viewers at home. Let's
Correct.
bring that up on the screen. Now, the promotion is till the end of February. You get $50 off your cosmetic treatment at the Lexington Vein Institute. I think that's fantastic. Let's bring up the phone number and the address as well. There it is. Give them a call. Go in. And if you're having issues with varicose veins, everyone, I'm telling you, Dr. Bacha is amazing. You've seen him. He's a friend of Midday Kentucky. It's a good man. Coming up.